Welcome to Everyday Woman. We have Dr. Justin West talking about plastic surgery after mastectomies. What are options for women to have reconstruction surgery after mastectomy?
Well, there's traditionally two main ways that we do reconstruction. The first is implant reconstruction. So most people have some sense of what that means. Lots of people know people who have breast implants either after reconstruction or for cosmetic purposes. So implant reconstruction is by far the most common procedure that we do in this country. Probably about 70 to 80% of women who have reconstruction generally choose implant reconstruction. It's a little bit simpler. You get out of the hospital faster. The other way to do it is to use your own tissue. So we find women all the time who come in and say, you know what, I'm not interested in having a foreign body in me. Can I use something that's a bit more natural? So depending on how that person's built, we can use parts of your body. So the classic one, when somebody comes in, they have a little bit more tissue around their belly than they were happy with.
So you get that 2 for 1.
Much better.
The tissue that we often remove when we do a tummy tuck, we can take that tissue and instead of throwing that away, we can actually use it to build a breast. And it's a very soft, natural breast. It's your own fat, which is similar to the density of your natural breast. And then you get a slightly flatter belly, and you get a breast that you might be happy with for quite a long time. It's a bit more involved, but that's sort of the big picture. Usually it's implants or using your own tissue.
Okay, and we're laughing about this, but what's the psychology behind women seeking reconstruction surgery?
Well, I think that we sort of touched on it earlier, and that is, I think that what I find and what, I've never been through this process, and I won't go through this process. Right. So I learn from listening to my patients and watching them go through this experience. And what women share with me on a regular basis is, they tell me they just want to feel whole. They want to feel feminine. When they get out of a shower, they want to look at themselves and like the way they look.
So they don't really care about going from like a size A to like a size D. They just...
Well, we get that. We have to remember, we have people who are diagnosed in their 20s, and we have people diagnosed in their 70s and 80s. We frequently get young women who come in, they say they're 23 years old, they have a new cancer diagnosis. And it's thrown them for the loop. This is not what they're expecting at this age. They're just sort of young, having fun. Mm-hmm. And so they'll often come to me after our conversation and say, you know what, Dr. West, after thinking about this, I thought about having a breast augmentation in the past. Can I be a little bit bigger than I started? And we do that. And for other women, we often get large-breasted women say, gosh, I've walked around with large, heavy breasts that hurt my back. I get neck pain, back pain. I get grooves in my shoulders.
So either way.
Yeah, and they may say, gosh, at the end of this, I'd like to be a smaller version of them. They like to be a smaller, perkier version of themselves. But ultimately, the common theme is they want to feel whole. Right. It's not cosmetic surgery. It's about restoring their femininity so they feel whole. They want to be able to fill out their clothes. They want to be able to fill out a bra and wear the clothes they're used to wearing.
Yeah. Now, does insurance cover
yes.
reconstruction after?
It's a federal law, the Women's Health and Reconstruction Act that was put into effect during Bill Clinton's presidency. It's federally mandated that your cancer side as well as your non-cancer side is covered by insurance. Each state has their own version of that law. But what that means is if you have a left breast cancer, that the reconstruction of that left breast is covered. And then whatever you need done on the right side is covered, whether it means putting a small implant to match, or doing a lift to match, or doing a reduction to match.
I had no idea. That's really good to know.
Yeah. And on top of that, we have women who are 5 years out from their surgery or 10 years out. Someone who had reconstruction 20 years ago where the techniques weren't as evolved. The revision of that surgery is also a covered benefit. So we get in our office frequently women who come in 10 or 15 years later say, I was okay with this for a while, but I've seen my friend. My friend went through this recently, and she looks so much different than I do. And we talk about revision procedures, and that's something that should absolutely be covered by insurance.
Mm-hmm. And who qualifies for it? Like, is there a certain age?
No, anybody.
Okay.
There's no age restriction.
Okay.
And we don't expect that there's going to be one anytime soon. And if it comes up, we'll fight for women to get that right.
And do you find a lot of women coming back, after the act who may have gotten some reconstruction? I mean, is that common?
I've had 92-year-old patients come in 15 years after their reconstruction. Wow. Very fit still.
Want to wear bikinis?
Well, not necessarily. But, people who say, what, the woman came in about a year ago, said, I know I'm older, but I still really care about the way I look. I still want to look like a woman. She'd had a reconstruction. The implant had fallen out of its ideal position, and we moved it back. Not everybody at 92 is going to be a candidate for surgery, but for somebody who's healthy, you don't lose that right to reconstruction and revision with age.
I think that's such a great option to have to go through something that is just so horrendous and to be able to have those choices and options, if you so choose, and not just immediately after, but lifelong.
Absolutely.
That's really, really good to know.
Well, thank you so much for sharing this information. I mean, there's stuff in here that I never knew that, basically people can go back and still revisit and become the person that they were and, continue that way. So thank you so much, Dr. Justin West. If you want more information, you can visit breastlink.com.